Surgical removal of the tumor is a common treatment for breast cancer. There are a number of surgical techniques, and your doctor will help you decide which is best for your situation. In addition to removing your breast tissue, it may be necessary to remove some or all of the lymph nodes under your arm. Before the procedure, an intravenous line will be started, and you may be given an oral sedative to help you relax. Breast surgery usually requires general anesthesia. A breathing tube will be inserted through your mouth and into your throat, and you will be given medications to put you to sleep for the duration of the procedure. Depending on the type of procedure, breast cancer surgery usually takes 1 to 3 hours. The main surgical procedures are lumpectomy and mastectomy. A lumpectomy preserves the appearance of the breast. The tumor, along with a margin of surrounding tissue, is removed. In this procedure, your surgeon will make an incision in the skin and separate the tumor and a margin of healthy tissue from the breast with a scalpel. Then your surgeon will remove the mass with forceps, send it to the pathology lab for examination, and close the wound with sutures. In a mastectomy, the entire breast is removed. This is usually indicated when the tumor is too large for a lumpectomy. In a simple mastectomy, only your breast tissue is removed. Your surgeon will begin by making an incision around your nipple. He or she will then separate your breast tissue from the muscle underneath and remove it for examination. Finally, your surgeon will insert drains to prevent fluid collection before closing the wound. The most common type of mastectomy is a modified radical mastectomy, in which the entire breast and some or all of the lymph nodes under your arm are removed. In this procedure, your surgeon will make an incision along the length of your breast, separate your breast tissue from the muscle underneath, and remove it for examination. To remove the lymph nodes under your arm, many surgeons use a technique called sentinel node biopsy. In this procedure, dye is injected into your breast to determine which lymph nodes drain fluid first. It is these lymph nodes that are most likely to contain cancer. Your surgeon will remove 1 to 3 of these lymph nodes for examination, insert drains, and close the wound with sutures. In a radical mastectomy, the breast, underlying tissue, muscle beneath the breast, and all visible lymph nodes are all removed. Your surgeon will begin by making an incision along the length of the breast. Next, he or she will separate all of the breast tissue, muscle from the chest wall, and visible lymph nodes, and remove them for examination. Finally, your surgeon will insert drains before closing the wound. After your breast surgery, your breathing tube will be removed, and you will be taken to the recovery area for monitoring. Lumpectomies are often done as outpatient procedures. In this case, you will be able to leave the hospital after several hours. If your surgery is done as an inpatient, your doctor will generally have you remain in the hospital for 1 to 2 days to monitor your recovery.
Broccoli and broccoli sprouts produce a compound, sulforaphane, that appears to target breast cancer cells. But this is in a test tube, right? How do we even know we absorb sulforaphane into our bloodstream when we eat broccoli? And even if we do, how much do we have to eat to arrive at these test tube concentrations where it counts, in breast tissue itself, where a tumor may be evolving? An innovative group at Hopkins figured it out. Let's find women scheduled for breast reduction surgery, and an hour before they go into the operating room, have them drink some broccoli sprout juice. And that's what they did. They collected breast tissue from 8 women an hour after broccoli, and here's what they found. an average of 2 picomoles per milliliter in their left breasts and 1.45 in their right. So now, for the first time ever, not only do we know that the broccoli we eat ends up in the right place, but we know the final tissue concentration. So what does that correspond to here? This is what broccoli sprouts do to both estrogen receptor positive and estrogen receptor negative breast cancer cells. To continually bathe the tissues of one's breast at this concentration, you'd have to eat a quarter of a cup of broccoli sprouts a day, a half a cup, and about a cup and a quarter. In other words, it's doable. I just put them on my salad. Real-world effects at real-world doses.
Let's just talk for a little bit before we go to break about the type of breast cancer that you were diagnosed with.
It's invasive lobular carcinoma, which is the rare type of cancer. I think it's 10%
right, you're
of
absolutely
women.
15%. You had lobular, and the most common one is ductal. In the breast, you have the ducts and the lobules. The lobules are the sacs or the glands that produce the milk, and they're surrounded by fat tissue and a whole matrix. But these lobules can develop cancer cells, and what happens is if they outgrow the basement membrane, that's when they can spread to other parts of the body. Now, a lot of times with lobular cancer as opposed to ductal, it doesn't make a discrete mass necessarily. That one we talk about as doctors, feeling like a pea, grape, M&M, but it's more just like dense tissue. We are so happy that this little one helped to save your life, because the earlier that we can detect it, always the better. And so now you are a huge, not only advocate of dogs helping you out, but what else would you want to say to women out there?
To get a yearly mammogram, it's so easy. Everybody's busy. Everybody has a lot going on in their life. And to just say, you know what, I'll just wait a year, because another year in my cancer would have made a huge difference. Mm-hmm. And when I saw the two mammograms side by side, the previous one, there was absolutely no cancer. And a year, 15 months later, there was not only cancer, but the whole breast tissue had changed.
And the health benefits of pets just keep coming
keep
along and along. They're not only
That's right.
stress busters, apparently they can be cancer detectors as well.